I'm Dr. Jada Hamilton. I'm one of the physicians at Cornell Health. I've been at Cornell Health for about, I don't know, 7 years, going on 7 years right now. Maybe it's 6, I don't know, I've lost count. But it's so great to see everyone here. I'm gonna just give you a quick PowerPoint overview of the services that we offer at Cornell Health. Keeping in mind, because of the whole pandemic situation, some things have been shifted, altered, fluid. So there may be some changes upcoming, over the fall semester. But again, this is just a quick overview just to sort of introduce you to Cornell Health. All right. So Cornell Health is basically where you're going to come for your basic healthcare needs. And then when I say healthcare, I also mean mental health, emotional support, etc. And the philosophy of Cornell Health is sort of this patient-centered model of care where we take care of the person as a whole. So when a lot of people think of healthcare, they think, or medical care, coming to a clinic, they think of physical symptoms, they think of sprained ankle. But at Cornell Health, we basically take care of you as a whole. So if you're coming in for a sprained ankle, but also have some sleep issues, we can address all of those things at the same time or within a short period of time. And we basically help you to stay healthy so you can enjoy the benefits of being in Ithaca and being optimizing your educational experience. So it's sort of, you can't, unless you are healthy and well, you're not going to be able to learn as you want to and participate in everything that Cornell and Ithaca has to offer. So that's sort of our philosophy. You see the wheel sort of describes sort of what we try and sort of how we take care of everyone and all the students on campus. Location for students, I acknowledge that there are some students who may not be in Ithaca or at Cornell, the Ithaca campus right now, but at some point you may be. So just to kind of give you a quick overview, we are located on Hope Plaza, kind of like, actually we're right next door to Willard Strait, and also across from Olin, that's engineering building, and quite accessible if you live in other places around Ithaca or on campus. TCAT bus, a quick walk also can be accessed for Cornell Health Services. Right now, I'm just going to give you a little blurb about our hours. We are in the summertime, so we still have our summer hours. We are working on what things are going to look like in the fall. Again, things are changing quite a bit based on what's going on with the pandemic. Currently, we are open 8:30 to 4:30, and I put the quotations in because currently our building is not open just for general traffic and people coming in and wandering in. You must have an appointment, either an in-person appointment, an appointment for COVID testing, or needing lab work or pharmacy services, or even x-ray. We have a sort of a screening service right now that we have to sort of, that's how you get into the building. So you call in a number that's posted on the outside of the building, and then someone inside will kind of talk to you, make sure you don't have any COVID related symptoms, and then basically help you get your services that you're required. Current services include some limited in-person care. So in the building, we have a pretty robust telehealth service. So basically Zoom meeting with your physician. It's all secure and privacy protected. We also do screening appointments for COVID. We also have COVID testing in the building for symptomatic kind of stuff, not the screening that's part of the surveillance, but if you have a cough or a sore throat, we can kind of help you get those tests as you need. Then of course, pharmacy services, lab, and x-ray. There's a phone number there on the bottom, but I don't expect you to remember that, but please check the website and I'll have another little slide at the end about that. So those are our services and basically locations and hours right now, but that may change, of course, during the fall semester. And if you have any questions, just hold them to the end. I'm going to hopefully get through this pretty quickly and we can entertain any questions. So a few questions, you don't have to blurt them out because it's a little bit different situation than in person. But when you are ill or injured and need assistance, who should you turn to first for help? So your options are WebMD, your pre-med friend, because they know everything about medicine, a convenient care center, the emergency room at Cayuga Medical Center. For those of you not familiar, that's our local hospital, or E, Cornell Health. I'll give you 2 seconds to think about it, and I'm sure you all got this correct. Cornell Health. So that's where you want to go first. Because we're accessible, we have a 24/7 on-call service that if you have any questions or concerns, we can kind of direct you to where you need to get help. So, like I said before, we sort of have an integrated approach to healthcare at Cornell Health. So the whole person care basically runs the gamut. So if you feel ill for any reason, have an injury, like I said, we offer, x-rays, we can treat fractures and sprains and strains. We have nutrition services. So if you're concerned about your diet or eating habits or just are curious on how to eat better and feel healthier. Of course, this is a college campus, university campus, so we definitely have a robust services that provide consultation, treatment for anything related to your sexual health, your sexual identity related to sex, of course, trouble sleeping, need of flu shots or immunizations, prescriptions, or pretty much any health concern. Again, I do want to sort of acknowledge that during this sort of pandemic time, some of our services may be a little bit more accessible than others, but we are working very hard, depending on how much acute care services are needed for COVID-related illnesses, we should be able to kind of care for pretty much anything that students have a question about or concern about. So again, primary care, that's where I work. So that basically takes care of anything that you may come in with, whether it be a headache, a sprained ankle, sleep issues, sexual health care, women's health care, pretty much anything. We also have nutritional care, sexual health services, behavioral health care, and behavioral health is a social worker or psychologist that works with us in primary care. So that's different than our counseling and psychological services or CAPS, and they work sort of very closely with with us as clinicians. So, for example, if I have a student who is seeing me again for headaches, and it turns out that they're having some concerns with depression or anxiety, I can literally go down the hall, actually connect with our behavioral health consultant, talk to him or her about your concerns, and then if it's okay with you, they could actually meet you that same day that I see you, and then schedule some follow-up care versus, as far as counseling and therapy. So whatever that might work for you. So that's something that we're seeing a lot of, and it's very beneficial in that sort of the primary care setting. Of course, immunizations, flu vaccine, that is coming up very soon. Allergy shots, we did do that pre-pandemic. Right now, for students who require allergy shots, we are doing referrals to the community just to limit the traffic into the building. And same for travel clinic. Sports medicine, we do have a robust sports medicine department because of all the teams, of course, that we have on campus. Right now, we are not active in our sort of sports right now, but we're still very busy with that. And of course, physical therapy, which is not located in Cornell Health in the same building on Hope Plaza, but it's just a couple of blocks up right next to Shilkoff Field, which is the big football field. And of course, lab tests and x-rays and pharmacy. And I just want to mention pharmacy, those prescriptions can be accessed if you have a doctor or physician out in town or locally or from home, and you want to send your prescriptions to the Cornell Health Pharmacy. That's a great way to do things. And of course, for students who see clinicians or physicians in the building, we access your prescriptions to the pharmacy there. We also have a few other services that are helpful for students. We have our student disability services that provides support for disabilities of any kind, whether it be sort of difficulties or changes with learning, or if you need help getting around campus. For example, if you broke your ankle and you are on crutches and you need some help with transportation, that kind of thing. So those are the things that can kind of help those services can provide. And again, student health benefits is sort of the health insurance sort of office. I don't deal with a whole lot of insurance related concerns. However, if a student has a question about if something's going to be covered or the cost of seeing a specialist, they would be the best ones to sort of answer those questions. For students who have the student health plan, as long as you have a referral, that service is covered. So that's just something just to kind of keep in mind. So just try to avoid, going out to see somebody without a referral. You may incur some extra, costs unnecessarily. And then we also offer a robust language and translation service. It's not a physical person, but it's a sort of a phone-based service that we have over 200 languages that can be requested. So if that's something that would benefit from, just let us know, ideally ahead of time for the appointment. That way we can set things up. But again, that's something that is offered, and if you feel more comfortable, having that available just to talk about your healthcare and medical needs, I think that's a great service that we offer. Victim advocacy, that is something that's also provided from Cornell Health. It involves several Cornell Health staff. So if you have any kind of sexually related incident, violence incident, harassment, that kind of thing, we do have supports for that, and it's just a matter of connecting with us. You can give us a call and we will be able to direct you to the service that you need. And patient advocacy, this is an important sort of part of healthcare and pretty much anything that we want to hear from you. So we want to know how your healthcare went. If there was something that was a concern or that you felt like your needs weren't met, we do want to know, because that's how we can improve, and that's how we can best serve our community. So please don't hesitate to utilize that. There is a phone call that you can make if you want to be anonymous or not really say a whole lot about, you just want to provide that feedback. That's something that we also are, we welcome. But I think it's really very important to be able to share with us how your experience has been, whether either good or bad. Okay. And then referrals, sort of alluded to before. We do offer quite a bit of services at Cornell Health, but of course we're not surgeons. We don't do surgery. There's some things that we don't do procedurally. So if there's a concern or an issue that needs to be addressed by one of our local specialists, we put a referral in, and fortunately in the Ithaca area, we have pretty good access. So most students can get in within days to get that service, or maybe a week or two. So, and with the pandemic, that may shift a little bit, but again, there's still pretty good access for our referrals and referral partners. And what percentage of students do you think visit Cornell Health every year? So I'm just going to go ahead, less than 10, 30%, 60%, more than 80% of students on campus visit the health center. So we're pretty well utilized, and this includes physical health, medical needs, and also mental health concerns or emotional support. So all your visits, including your telehealth visits, if that's something that you need, are confidential, meaning your health information doesn't go anywhere else except between you and the clinician or provider. It doesn't get shared by professors, your coaches don't know, your parents don't even know. So the only time we will share information is if you give written permission to share. And that's important. So your mom or dad or, boyfriend or whatever, girlfriend, can't just call up and say, hello, I'm so-and-so. I saw, I noticed that, my friend or my son had an appointment today. How is he doing? What can you tell me? We cannot do that unless you have written permission. So anything that you go to the Cornell Health for remains confidential, regardless of the issue. Okay. Now, I want to say there's a caveat. If there's a substantial injury like life-threatening illness, definitely we would be reaching out to your next of kin, who family member and that kind of thing. But everything else is pretty much confidential and is not shared with anyone. These are a list of our providers. We have over 200 staff members at Cornell Health, and that includes physicians, nurse practitioners, physician assistants, psychologists, psychiatrists, social workers, physical therapists, nutritionists. We have health educators. So there's quite a bit of staff members that help support your health and wellness while you're here on campus, or even if you're remote. When we're closed, of course, any emergency, always call 911. There is a local hospital, like I alluded to earlier, Cayuga Medical Center. That's the only hospital, and that's where our local emergency room is housed. If you have urgent concerns, but it's not an emergency, for example, if you significantly sprained an ankle and you're having trouble walking, you may not want to wait, a couple days before an appointment to Cornell Health. I would recommend utilizing our sort of convenient care, urgent care services, and there's several in the area. And then at any time you have a question, please call Cornell Health. This main number, the 607-255-5155 number, is during the day is answered by one of our nurses, and if needed, one of our physicians or clinicians would also take the call. And then after hours, we have a 24/7 on-call service that provides advice to anyone. Okay, so that's something just to keep in mind. So don't be afraid to call and just get that advice, and hopefully we will get you in the right place at the right time. Payment, right now there's a student health plan. Some students, many students enroll in a sort of the health plan at Cornell. Some have private insurance. Either way, there's a copay that's associated with the visits. If a student has any sort of financial concerns, that copay can actually be waived. And the nice thing about the student health plan with private insurance and sort of the health fee is that everything that's done in the building is covered under your visit. So you're not paying extra for x-rays, you're not paying extra for lab work, you're not paying extra for if I give you crutches or give you a splint or a brace or IV fluids. All of that is covered under the $10 copay. So just keep that in mind. And the Student Health Plan Plus is a Medicaid version of the Student Health Plan, and that's something specifically for students within New York State who would have that coverage. And no copay for most services. And again, like I said, financial barriers, we can definitely take care of that. And if you have any questions about your health benefits or costs or concerns, definitely connect with the Health Benefits Office directly. I just want to also just mention that for Cornell Health and the insurance plan, it does not cover dental, and it doesn't cover like eyeglasses and eye exams and things like that. So that would be a separate cost. Just to kind of keep that in mind if you're concerned about dental care and getting your, dental maintenance and things like that. And there's just some health requirements, but I'm sure you've all already heard that there's, when students are enrolling, there are certain things that we want to make sure that you're covered for as far as immunizations, if you have any chronic health conditions. We definitely encourage students who have any ongoing health concerns to try and connect with your physician or clinician at Cornell Health. The earlier, the better. That way we kind of get to know you and sort of know your history. And if there's something that comes up, we can kind of say, oh yes, I know so-and-so. She, we talked 2 weeks ago. I know what's going on. Let's have her come in for an appointment. So it just makes it easier for us to sort of know your history, especially if you have something that's sort of significant and ongoing that may impact your time here at Cornell. And anyone who is here 6 months, taking 6 months, taking 6 or more credits, is required to have all your immunizations up to date and all the requirements that we recommend. This is the website. This is super important. I know one more thing to look at, but this is our main website. It was just updated pretty much a few days ago. And it sort of describes all the services currently that we're offering. Especially with the pandemic and with some changes. There's even a section for students within Ithaca who are actually here on campus or in the Ithaca area, and then also for students who are international or out of the Ithaca area, including sort of New York State. Because there's been some changes with some regulations as far as services that we could provide for students who are like in Texas and or Colorado and who elect not to come back to campus. There's some limitations about the services that we can provide even via telehealth unless you're within New York State. So I encourage everyone to please take a look at that, because that will describe if you have sort of things, situations unique to you. Definitely take a look at that. Otherwise, just kind of peruse it. Just take a look at the services that we offer. There's a lot of sort of self-help, health topic related kind of things, how to take care of yourself. So in sort of my role here at Cornell, just as I'm a physician, of course, but in college health, I think for us, it's important for us to sort of consider keeping you healthy, maintaining optimal health and wellness so that you can enjoy your time here at Cornell, optimize your learning. But you're also, some of you may be sort of embarking on the healthcare services on your own without your parents sort of telling you what to do. So it's our job to sort of help you be advocates for your own healthcare and help you navigate that. So I think the first part of that is, of course, listening to a talk like this, but also just going on the website, seeing what we offer, seeing how do you make an appointment. Right now, pre-pandemic, we were offering online. Most of the appointments were scheduled online. You go into your portal and you can schedule your appointment online. We have not brought that back yet. So for most students, you have to call to schedule an appointment. And as services expand and as the pandemic sort of wanes a little bit, we will be bringing back online appointments. And one last thing I want to just mention regarding access and services, I just want to make sure for students who are here on campus that to optimize the access to the health services at Cornell Health. In this time, we want to make sure everyone is contributing to a healthy and safe community. So it's all of us that sort of makes sure that we don't have a huge outbreak or clusters of, concerns, because if that happens, all of our resources and energy and access will be devoted to those acute respiratory COVID related concerns. It'll limit sort of, somebody be able to come in and I just want to get my, GYN exam or my pap smear. I just want to talk about my, sleep issue. So just keep in mind that we all have to do our part when we're here in Ithaca to make sure we all stay as healthy as possible so that everyone can enjoy and have equal access to the Cornell Health Services.